Jason, welcome to Crosstalk. April is Head and Neck Cancer Awareness Month, so we really wanted to get together with you and highlight advances that are happening in the field. We also want to welcome you as a new director of the Division of Head and Neck Oncology in the Department of our Otolaryngology. The new leader, you're going to be guiding the strategic growth of our cancer programs. You're also going to help us with the network across the state. And we're very excited about that. I know you've had experience with that in Pennsylvania and at UPenn and everything. So we really want to reach out to our network and welcome them to the Hollings campus. Before we talk about some head and neck cancer treatments, let's talk about your two important roles here. What drew you to join us in March, and how are you settling in here in Charleston?
Yeah, so first of all, thank you, Ray, for the invitation and for introducing me like that. I'm excited to be here. I'm excited to be part of this system and excited to be part of the network. First of all, Charleston has always been a place that I thought was amazing. I mean, many years ago when I first visited, I thought this would be a great place to live. So that probably set the initial stage for thinking, wow, like, is there an opportunity to ever go there? And then realistically, what happened was that the opportunity to build and grow the head and neck program came up, and I got a call about that. I mean, partly from you and from some of the other people, and I think the opportunity really presented itself as a great place to both build a program, to raise a family, and I think there was a huge opportunity. And from what I've seen so far, it seems like that's really what's happened, is that there's been a lot of real need for the cancer care that we can deliver here. And I think seeing MUSC and the Hollings Cancer Center really start to try to rise and grow across the state has really been something that in what I was doing previously at Penn, this really lines up with that interest.
Wonderful. We're really happy that you're here. I was even out searching for houses for you to make it happen.
Thank you, by the way. I appreciate it.
So, as you know, South Carolina is a very rural state, and we have a lot of places that are sparsely populated. What do you think expanding our care across the statewide area is going to be important? How's it going to help those patients?
Yeah, so I think when I think about South Carolina, there's clearly some big medical hubs, and then there's a lot of places that are going to need care that's a little bit further. And I think that actually lines up nicely with a model of care where you try to get as much of the resources into the local and community hospitals. Because I think patients often get the best care when they're supported by their local networks. So I think the idea of being able to deliver not just head and neck cancer care, but all cancer care as close to home as possible really should be one of the missions. And it sounds to me like that's actually one of the things that the Hollings Cancer Center is really trying to do. And I wholeheartedly subscribe to that.
Yeah, I mean, we claim the whole state as our catchment area, and part of our NCI status depends on us being able to serve that catchment in a number of ways, which you know about. And this is one of those, and I think it's going to be really important going forward to try to achieve the comprehensive status that we're going for.
So, I mean, when I think about, trying to get into the community and create a level of care that is compatible with the brand that MUSC and the Hollings Cancer Center want to create, I think that's really one of the main overall goals.
Wonderful. Now, you've had some impressive roles before you came here. How did that prepare you for doing what you're going to be doing here and all of the variety job titles and other things that you're taking on?
Yeah, it's a good question. I mean, I think I was in I was in a few roles, but I think the two roles that probably most prepared me for this, one was that I was already the director of the Head and Neck Cancer Division. And I was in a market that is a very busy, the Northeast, very busy area. And I think even in that area, we were able to really make the group that we had shine, despite the fact that there was a lot of other great programs. So I think that's one thing that I feel like I learned a lot, how to build a program that starts with the group that is the primary caregivers for patients who have these cancers. The other role that I played was I was the director of one of the cancer programs for Penn's, one of the downtown campuses called Pennsylvania Hospital. And I think that really prepared me for understanding how various parts of a cancer program work together. Understanding that not everywhere is going to be kind of the mothership, let's say, but a lot of programs can actually build components that are compatible with that, or that can kind of serve nicely to help the patients who can be, but also work closely with the other programs to make sure that the handoffs between programs works really nicely.
Wonderful. Well, you've already been rapidly expanding your team, even before you hit the ground here. Can you tell us something about these new hires and how they're going to, what duties are going to serve on the team and how they're going to help you out?
Yeah, sure. So I would first emphasize that there have already been some great people here. So, Evan Grayboys and Judy Schoner, I mean, they're two of the people who served as part of the foundation for this program. And I think I'm clearly grateful to them for some of what they've already done and how they've already worked so nicely with our team. So that's great. Two of the people that we've brought on most recently, one is Angela Yoon, who is actually in this dental school, but really does a lot of work in head and neck cancer and oral cavity cancer. So her role, she has a lot of research background and is really coming to the table to bring a research side to the clinical part that we're doing in head and neck cancer. And I think that's really important to really make sure that we're not just delivering the clinical care, but also emphasizing that the research is part of our mission. The second person that I would highlight is one of the people who actually was trained here, and so was a fellow previously and has a lot of connections to Charleston and to South Carolina, and was as a head and neck surgeon who was most recently in Georgia, and his name is Greer Albergati. And he has really been a great partner on the clinical side to help grow what is really the most urgent need, which is clinical care for the head and neck cancer population in all of South Carolina.
And speaking of head and neck cancer, why is it that those patients need such specialized care? And then, they're probably not going to get that kind of care in some of the rural areas. And why would they need to come here for that?
Yeah, so these, in my mind, are some of the most complicated patients that we can manage. When I think about all of the things that we do to those patients when we do surgery and when we radiate and we give them chemotherapy, we're interrupting a lot of the things that make their life good. The swallowing, even breathing, talking, being able to socialize with someone, all of those things are affected, and in a way that's very complicated. We're doing surgeries that are sometimes 10, 12, 14, 16 hours long. The team that we have to take care of those patients has to be big. And it has to be big because each of those people plays a specific role in helping those patients either get through their cancer management, or taking care of them after surgery, or in between surgery and radiation, or getting them back to their swallowing function. So it really requires a big team. That being said, I still feel like we know we can get some of that care delivered back close to home. Things like the radiation potentially, or the chemotherapy, or the nutritional needs. So we really want to make sure that it kind of feels like a meshed network to allow that to happen.
Yeah, and I think your role in shaping that network is going to be really helpful, especially, a little bit, glad that you're involved in that, but this could coordinate those things a little bit better. So as you said, we're blessed to have Dr. Grayboys here. He's a worker bee and gets a lot of things done. So why do you think survivorship is especially important to build that program in head and neck cancer patients?
Yeah, so as you're alluding to, I mean, Dr. Grayboys has really taken the lead, not just in head and neck, but also in a lot of cancer areas of growing the program that represents survivorship. So I think in the cancer world, we are seeing that luckily a lot of patients are surviving their cancer. So if you think about, the evolution of cancer care, I feel like, we are just happy that patients are surviving. But now we're thinking, okay, well, you've gotten to survival, but maybe we should do better in that domain too. We can anticipate the patient's needs. We can imagine treating them in a way, the same way that I think about things like colonoscopies and mammograms. Like, we know what can come down the pike for these patients. Let's anticipate it. Let's prepare for it and prepare the patient for it. So survivorship, and again, as you're saying, Evan has really taken the lead on this. Like, how do we better frame this around a patient to allow them to have a better experience after they've conquered their cancer? And so I think that is starting to become a very important topic as we realize that just curing the patient is not a good enough answer for how have we taken care of that patient. So I think we're starting to get a better idea of what that takes, and I'm excited to see that the cancer program in general is really supporting Evan's efforts to grow that into something bigger, and he's really excited about it. I just actually spoke to him right before this, and this is one of the things that he does in his free time also.
Yeah, no, we're really excited to have him, and it's something that we've been missing here, and it was something he's very passionate about. So it's a win-win, and we're more than happy to invest resources into it. So you talked a little bit about this yesterday, but there's a lot more effort now to personalize treatment for all cancers, but also for head and neck cancer. What's going on in that realm that you think is really exciting?
Yeah, so there's a couple things. I mean, I think we talk a lot about this idea of personalized medicine or precision medicine. And I think we are entering an era where we're seeing precision medicine and we're also seeing precision surgery. So specifically, I think there's two different things that the head and neck team is doing, and there's actually more than two, but I'll tell you about two of them. One of them is going back to what Dr. Yoon is doing, which I think is really exciting. So we know that tumors don't always behave the same. So even if you see a tumor that's the same size, that doesn't always mean it's going to act the same way. So we understand that, and now we're starting to dive further into understanding that. And the way we're diving in there is by doing profiling of the molecular side of these tumors, whether it's RNA, DNA, genetic expressions. So Dr. Yoon is actually doing microRNA expression profiling to help predict how certain cancers in the mouth are going to do. So she can actually apply this test to cancers that have been biopsied and tell with a much higher sense of accuracy how those patients are going to do. That allows us to make more personalized treatment for patients who have different types of tumors. So if we know your tumor happens to be really aggressive, maybe we will treat it with surgery and radiation and maybe even chemotherapy. If we know that your tumor is in the category where it's not going to behave so aggressively, then maybe if we do a good surgery, that's all you need, and you can not need the rest of it. So that's really how we're personalizing it in a way that allows us to treat it differently in each person. So the other area that I would mention is precision surgery. And precision surgery really is amazing because what we're doing is we're actually taking molecules in the operating room, and we are using fluorescence to help identify tumors much clearer than we could just with white light. So, as I know you saw last night, sometimes a picture is worth 1,000 words, but when you see the margins of the tumor glowing, it allows you to both save some of the normal tissue more easily than you otherwise would have been able to, and it allows you to get the tumor out more confidently, knowing that you're kind of finding that perfect space between removing tumor but leaving as much normal tissue as possible. So we're further entering that era where we can actually target individual tumor cells in a way that allows us to be more precise during surgery.
Yeah, that's great. And the other thing you talked about yesterday, there's a virus called HPV that seems to be involved in a lot of head and neck cancers. What are we doing? Are we treating those a little bit differently? I know there's a lot of work looking at immunotherapy combinations with surgery and other things. Are those things that you think are important?
Yeah, for sure. I think what I always like to tell people about is that the HPV, the human papilloma virus, has become one of the most important viruses in the cancers that we treat in the head and neck. And when I've showed people the data that we are now seeing more cancers in the head and neck caused by that virus than we are seeing cervical cancers in this country, I think that really makes people understand how big of a deal this is in the head and neck. The one good news about, or several of the things that are good news, is number one is that we actually have a vaccine. So as a head and neck surgeon, I find that I do much more public service announcements about the vaccines than I do about most other things other than maybe smoking. That's one area that is positive, is that we can actually vaccinate people and prevent the next generation of people from getting this cancer. The other thing that's good is that patients generally actually do better when their cancers are caused by this virus than the patients that have a cancer not caused by it. So what that's done is it's opened an entire area of interest in de-escalation therapy. So that's a pretty rare concept in cancer, but we are actually starting to routinely think about how can we decrease the amount of therapy we're giving to those patients, knowing that generally their prognosis is excellent. So, we want to cause less harm with our treatment than the cancer does. So obviously we want to start to see, can we do less therapy? But you have to tread cautiously here because of course we don't want to overshoot the wrong direction. So we are part of the place that's going to be doing those studies, and we actually just literally today we're having a conversation about getting involved in studies that help us slowly and cautiously but efficiently get to the end of some of those questions.
Oh, that's great. Well, one of the things I was really excited about with your recruitment was your interest and support for clinical trials. So what are you doing in assembling your team or other issues that you need to deal with to help make sure those get done?
Yeah, so I strongly believe that research is such an important part of how we manage cancer. And I've said it before, but I believe that research cures cancer, meaning we are standing on the shoulders of the research that was done to allow us to make the decisions that we're making both in the operating room and when we give radiation and when we give chemotherapy. So in my mind, we should look at every group of patients, and if we don't think we already have all of the answers, we should be figuring out, well, then what research questions can we ask to help us get to that answer? So we actually just met today with our clinical research team to look at a whole host of opportunities to have patients at their choosing get involved in a research study. We're not always experimenting with one treatment versus the other, but we're really trying to answer a question of if we do this compared to that, do we see a difference in the outcome, and can we get a better outcome when we do something different? So I think that's important.
Well, I'm really excited that you're so interested in that. It's really going to help the Cancer Center. So as I mentioned earlier, it's Head and Neck Cancer Awareness Month. And what do you wish the public knew that they don't know about this particular disease that could really, really help?
Yeah, so head and neck cancer, unfortunately, is a pretty common cancer. And it's certainly not in the top 2 or 3 cancers that we see, but it's still in the top 5 or 6. And I tell people that 1 out of every 20 cancers is a head and neck cancer. So number one is it's more common than people think, so that you should keep your eyes open for it. And this is something I think is important not only for patients, but also for primary care doctors and for dentists and oral surgeons, just to keep their eyes open for the possibility that even a young patient who you might not have thought could have a cancer could have one. That's number one. Number two is that if you're a patient or if you're just a person and you are having symptoms in your head and neck, a sore, an ulcer, a lump in your neck, I usually use the 1 month rule. If you've had something that's persistent for more than 1 month and it doesn't seem like it's been there before, it's worth having that looked at, because a qualified person can help you decide if that's something to worry about. Fortunately, usually it's not, but it's also worth at least making sure someone doesn't think that. And then the other two things I think I've kind of touched on a little bit. Smoking. We know that smoking is a major cause of head and neck cancer. I tell all of my patients that as great as I am at what I do as a surgeon, if you quit smoking, you are going to do a better job at managing all of the side effects of your cancer than I can do with what I am as a surgeon. So that's number one. Number two is HPV. So, unfortunately, once you've had the virus, that vaccination doesn't work. But when my patients ask me, Dr. Newman, is there something I can do? I tell them, well, what you can do is talk to your family, your friends, teachers, even your care providers, and let them know that HPV vaccine is a cancer prevention vaccine. So it really is effective at preventing this cancer, and we know that. But it just still hasn't quite gotten out to the public. And even patients of mine who are physicians, I'm always surprised that they didn't know that either. So I really think that our job is still to make sure everyone understands that that vaccine can prevent this cancer.
Yeah, it's truly a lifesaver, for the general population. So, Dr. Newman, why did you choose this field?
That is a good question.
It's hard work, I can tell you that.
It is hard work. I think, it's funny, a lot of medical students ask that question, and it's tough. I think if you're lucky, you find yourself drawn to something that is both what you're passionate about and what you might also hopefully be good at. So I think that when you're first exposed to the very complicated anatomy that is the head and neck, I think you're kind of drawn into it. But I think what really kept me interested is the patients. These are the patients in my mind that have some of the highest levels of needs, but are also such grateful, amazing, brave people. And I have a list of people that I have had as my patients that I can't imagine being them because of how brave they are. So I really respect what they all go through, and I want to be able to be here to serve them.
Wonderful. Well, thank you so much for joining us for this month's Crosstalk. I want to thank Dr. Newman for being here today. And as always, if you have any questions about today's topic, we welcome and invite your questions. Please be sure to share your comments and questions with us. Before we close, is there anything else you want to add that we didn't discuss, or any other issues?
Well, I mean, first of all, I appreciate your inviting me to be here. I really enjoy the opportunity to try to get that word out about what we're doing here at MUSC and through the Hollings Cancer Center. I also want to thank you and Dr. Labadie and Dr. Zoss for really taking a risk and inviting me to be part of your faculty and part of your team. It's been really a great pleasure so far, so I really want to thank everybody for that.
Yeah, it's really a low risk for us, but we're happy you're here. So thank you for listening.
Thank you.